Okay, continuing from the sphenoid bone, again, the greater wing of the sphenoid is at the most posterior, the deepest, most posterior spot of the orbital section. And the greater wing is actually viewable right there, in that most posterior spot. And then from there is the superior orbital fissure. This is responsible for spinal nerves numbers 3 through 6, which play a role in our motor and pain functions. From the internal view, we're looking at it upside down, but right here is the lesser wing. You can see the ridges, they're pretty fine. And then the larger part would be the greater wing. And back to the orbital view, the optic canal is the small hole in the most medial aspect right there. Okay, and the optic canal is responsible for the optic nerves and the ophthalmic arteries that pass through that optic canal. And then right back to the superior view, this lovely square area is the sella turica. And this is responsible for the seat of the pituitary gland. Okay. Continuing on, we can view the ethmoid bone, which is this area right here. The most prominent portion is the crista galli, and that area is responsible for the attachment site of the meninges, and along the lateral sides of that crystal galli of the ethmoid bone is the cribriform plate, which serves as the roof of the nasal cavity. So it's not exactly viewable from the frontal aspect very well of this model, but if we were to be looking up through the nose, the base of that would be the roof of the nasal cavity. Onto the sutures and where they're located. This suture that connects the frontal bones with the parietal is the coronal suture. The suture that divides the parietal bones is the sagittal suture. And as we go to the posterior, we have the lambdoid suture, which divides the parietal bones from the occipital bone. And then we have the squamous suture, which is that fine suture here. Kind of creating some division between the occipital and temporal bones. Onto the facial bones. So of the facial bones, we have the maxilla and the alveolar process, which isn't exactly viewable on this model, but it would be right here. It's a small opening. Then there's the nasal bone and the zygomatic bone, as well as the zygomatic arch. That's this area that connects over to the parietal and temporal areas. The zygomatic arch is composed of two bones, the zygomatic process and the temporal bone right here. Then there's the ethmoid bone, which again we reviewed as the base of the, is the roof of the nasal cavity, but it's difficult to see in here. So if we were to kind of angle upward, it would be that part there. Then there's the vomer. That's this area that separates the nasal cavity. The two bones that are responsible for creating the nasal septum are the vomer, which is, again, this bone going right through the center, and the ethmoid bone, which is the roof of that nasal cavity. So they form a perpendicular and create this nasal space for the nasal septum. The inferior nasal conchi are a little difficult to appreciate on this model, but they'd be right down here, and they're responsible for creating an increase in turbulence when we inhale and breathe, so that the any debris in the air we breathe could be trapped by the mucosa. So kind of a protection, first line of defense for our respiratory system and airways. Then there's the mandible, which is this lower, larger piece. So the mandible is composed of the body, which is all of this side, all of this larger portion. It's composed of the angle, which is that corner down here, which we would call, our jaw, maybe jaw line, or the tip of our jawline, of the ramus, which is this back side here of the jaw, the mandibular condyle, which is the point where the mandible connects with the temporal bones, and the mandibular notch, which is this divot or space, and the coronoid process, which is that high point right there. Now we'll go on to discuss the vertebral column, which can be a little tricky to appreciate, but the vertebral column is composed of 4 areas: the cervical, thoracic, lumbar, and sacral and coccyx. Of these major areas, actually I'm sorry, that's 5 areas, but of those major 5 areas, there are 4 curves in an adult vertebral column. The first curve would be the cervical, which is a concave curve, but it's a little difficult to see. So it would be dipping in here a little bit. Then there's the thoracic, which is a convex. Then there's the lumbar, the lumbar, which is clearly concave, it divots in a little, and the sacrum, which is again convex, coming out a bit. Okay, and then there's the coccyx, which, depending on the gender, positions itself a little differently. The cervical vertebrae are composed of 7 vertebrae. That includes the atlas and axis. The atlas is the most superior, which is responsible for articulating with our odontoid process right there. And that enables us to shake our head up and down, giving the yes motion. Okay, and unlike the other vertebrae, or unlike our thoracic or lumbar vertebrae, the cervical vertebrae is unique in the sense that it's the passageway for our passage of the vertebral arteries and veins, which supply our brain in conjunction with the carotid artery with blood. So those arteries work together to supply our brain with blood. Very, very important. And they go through, you see this those channels right there, which are the transverse process. So on to the thoracic vertebrae, which there are 12 of. There's the spinous process, the transverse process, which is along the lateral sides, the intervertebral foramen, which you really can't view here, but that metal structure here is passing through the intervertebral foramen, That space is responsible for housing our spinal nerves.